the most common type of sleep apnea worldwide, including in Malaysia. A major symptom of this condition is loud snoring during sleep. According to a study conducted within the country's population, around 47.3% of respondents between the ages of 30 and 70 report snoring every night.
Sounds familiar, huh? But it's worth checking if OSA is the case. Better late than never.
So there are three main types of sleep apnea. So number one is actually obstructive sleep apnea. The second is called central sleep apnea, and the third is called complex sleep apnea, where there's a mixture of both obstructive and central.
In obstructive sleep apnea, we have a restriction of airflow through the upper airways. So when we say upper airways, we actually mean through the nasal passage, through your nose, or through your mouth.
So this is actually mainly caused because of the obesity and then excessive tissues around the neck where obstruct the airway. So when that happens, when obstruction occurs in the airway, the abdominal and the respiratory muscles and the chest muscles actually try to work harder to overcome this obstruction.
In central apnea, this is mainly due to the brain. The brain is not sending signals to our respiratory muscles to expand, and this can be seen in strokes, brainstem injury, people who go to high altitude suddenly, in certain conditions like Lou Gehrig syndrome. Then we have the central type of apneas.
The third stage will be complex sleep apnea, where there's a mixture of both obstructive and as well as central sleep apnea. In certain situations where someone suffers from severe sleep apnea may develop mixed sleep apnea, where there's a mixture of both. Again, the treatment might slightly differ between these two.
In adults, the commonest symptom that brings patients to see us is snoring. Snoring noted by partners or friends of the patient. Then they can also experience tiredness, frequently waking up with headaches, feeling like they cannot remember, heaviness of the head.
Why do they get morning headache? It is because of build-up of carbon dioxide as a result of hypoventilation at night. Or morning headache can also be because of poor sleep quality the night before. Dry mouth. Basically, dry mouth is because of during the night time they have frequent gasping for air. Okay, or they are mouth breathers, so they get dry mouths in the morning. Choking sensation, especially in the middle of the night, that's also another common symptoms of sleep apnea.
The patient can also experience being told by family members that they stopped breathing in the night, and it worried them. They had to be woken up, or they themselves will remember waking up choking and then going back to sleep again. So these are the common symptoms in adults.
Similarities between the symptoms of obstructive sleep apnea and central sleep apnea, which can sometimes make it challenging to accurately identify them. Common symptoms include extreme fatigue, even after a full night's sleep, loud snoring during sleep, persistent daytime sleepiness, cognitive impairment, leading to complications such as memory loss and difficulty focusing, waking up multiple times during the night with shortness of breath, intermittent breathing pauses during sleep, difficulty staying asleep, or insomnia, sweating and restlessness at night, morning headaches, especially upon waking, mood changes, including depression and anxiety.
Having sleep apnea will bring a lot of complication, not only to the physical health, but definitely to the mental health as well. Imagining yourself having sleep deprivation, even not long, even for one day, how will you feel? We would feel very tired, fatigued, and we found ourselves very difficult to focus while driving or even at work. Hence, we can develop irritable mood and also mood swing, and over time when the productivity very much affected, then people people with sleep apnea is prone to have depression.
So as we know that sleep apnea, treatment of sleep apnea requires holistic approach. Not only we have to tackle the complications of the disease, but we also need to take care of their mental health. So this will need a multi-modality treatment approach from various individuals.
Sleep apnea does not just affect adults, it can also affect children. It can mess with the connective function of the brain, memory for adults, and the learning curve in children. But keep in mind, the symptoms may differ between adults and children.
In children, it's slightly different. They may also have snoring, but sometimes it is noticed that they have hyperactivity, which can be diagnosed by some people as attention deficit syndrome, difficulty concentrating in the morning, failure to do well in school. When they're sleeping, they are constantly restless, moving around. There can be bedwetting episodes. Sometimes when they sleep with their neck extended up like that because they're trying to be able to breathe. So they might also experience some night sweats.
And mainly children who suffer from sleep apnea is because of certain factors. For example, they have a huge tonsil, so tonsil grade 3 or grade 4, whether they have adenoid hypertrophy and so on. So those are the children that might need an ENT assessment, whether they need surgery to treat the sleep apnea or not. Some children, they have actually small chin. They have a syndrome called Prader-Willi syndrome that is also predisposed some children to get sleep apnea.
Here are some of the symptoms of sleep apnea in children that should be given attention. Symptoms resembling ADHD, such as hyperactivity, poor focus, or underperforming in learning, frequent bedwetting, repeated movements of hands or feet during sleep, unusual sleep positions, acid reflux, or heartburn.
Obesity directly impacts sleep apnea in a few ways. Number one, we see it more in men. In men, we also notice especially the weight gain in the neck. So a large neck circumference, usually more than 17 inches, or ladies more than 15 inches, is significantly impacts because you have the extra padding of fat, which when you inspire, which is taking a deep breath, there is collapsing of the muscles, which further narrows our airway and contributes to a lack of oxygen in our body, which then triggers the apneic episodes.
But basically in the medical literature, we do have a questionnaire called Stop Bang questionnaire. So each alphabet actually carries a meaning and carries a point. So if the point is beyond 3 and above, it indicates that that patient has high risk of sleep apnea. So what is Stop Bang questionnaire? S stands for snoring. So if you have snoring, that's 1 point. T is tiredness during daytime. O is observed apnea. So your partner might notice that you actually stop breathing for a few seconds in the middle of the night. P stands for pressure, blood pressure. If you have high blood pressure, okay, that indicates that is a risk factor for sleep apnea. But it's also a complication of sleep apnea. So it's like a vicious cycle, hypertension. B is your body mass index. So if your BMI is beyond 35 kilogram per meter squared, that carries 1 point. A, age. As we grow older, the higher the chances that we suffer from sleep apnea. Age more than 55 carries another point. N stands for neck circumference more than 40 centimeter, and G is gender, male gender. So if you have a scoring of 3 and above, you are at high risk to get sleep apnea.
Sleep apnea can affect anyone, but several factors can increase the risk. Some of these factors are obesity. Excess body fat can interfere with the smooth flow of breathing. Large neck circumference. Individuals with thicker necks are more likely to have narrower airways. Male gender. Men are 2 to 3 times more likely to suffer from sleep apnea than women. Increasing age. Sleep apnea occurs more frequently among older individuals. Family history. Having a family member with a history of sleep apnea increases the risk of developing it. smoking, alcohol consumption, and the use of sedatives or tranquilizers.
Setelah mendapat putusan daripada sleep study itulah, dia masakan saya pernafasan terhenti ketika tidur tu selama 8 jam tu lebih kurang 365 kali jantung berhenti dalam masa 3 second.